Hi, this is Jessica DaMassa with WTF Health. I'm here at the Bayer G4A Accelerator launch in New York City, and joining me right now I have Aiden Fang. He is from Pillo Health, and he has this cool Internet of Things, pill dispensing, digital home health companion. So talk to me a little bit about this and why something like this is so important to have in someone's home.
Yeah, so thank you for having me, first of all. And, people have trouble taking care of themselves at home, and most importantly, keeping track of all their medications. I think all aging adults want to age at home, but doing so without the proper support can be dangerous. And that was the inspiration behind our company, in that one of my co-founders struggled to take care of one of his loved ones, and from that experience, why not build someone for the home to help take care of you and be there for you when you need it most.
So this is not plugged in, but I guess Aiden was telling me that when it is plugged in, it's got eyes and it blinks at you and it does things. And then I'd like you to show the back. So the back actually has this like cool little pill dispensing, I feel like I'm an infomercial right now, pill dispensing carousel here, so that this can be filled by like a caregiver, right? And then it will be dispensed every single day into that little tiny pill catching cup, right?
That's right.
All right, and so what else does this do? Because this is like a pretty significant device here.
Yeah.
What does it do?
Yeah, so the pill dispensing is just the beginning, and beyond that, the medications will capture your attention. So 2 months from now, I still know that the patient will be standing in front of Pillo to get their medications. And using that FaceTime we have with the end user, we can deliver content and services into the home. So, we start with general interactivity, weather, jokes, playing the radio. But then we also provide, educational videos about specific chronic diseases, surveys, and we can also connect with other devices around the home to be a hub for healthcare in the home.
Okay, so what other things can you connect with?
Yeah, so we're working to connect with smart scales to track weight, smart blood pressure cuffs, Fitbit to track your steps, so on. And there are so many out there, and we're working on getting all of them up and running.
And then what data are you able to pull in from this?
So we are able to pull all kinds of data that traditionally has not been available to healthcare providers and healthcare organizations. So in the form of, how is the patient feeling every day at a specific time? We can check for mood. We can even record a segment of voice to see what the tone of that voice segment is. We can also connect to other devices around the home, all in an effort to understand how the patient is feeling, how engaged they are in their care, and if there are risky situations that arise.
Okay. And then what happens if there is a risky situation? Is there something that this will do to intervene?
Yeah, so we can do a wide variety of things. We can trigger an alert to the caregiver's mobile app. We have a Pillo app that is currently on the App Store. And or if we're working with a healthcare organization partner, we can trigger an alert to their team, care coordinator, nurse, physician, to allow for maybe a check-in using the camera and the screen. It can be a telemedicine platform as well.
Okay. And I know like Internet of Things is kind of an emerging space still right here, and it's kind of going through, I think, like ups and downs in terms of, where the market is at with it. So what do you think the future is for Internet of Things as far as healthcare is concerned? Do you think are you optimistic, or what are your thoughts?
Yeah, I'm very optimistic, and we sit at this intersection between the rise of voice-enabled technologies like Amazon, Google Home, and the movement of healthcare more and more into the home. So we sit at this intersection, and I think the Internet of Things, new technologies have a lot to offer in terms of bringing care into the home where the user or the patient is most comfortable.
Very cool. Well, thank you so much for joining us. If people want to learn more, how do they find out about Pillo?
Yeah, visit us at pillohealth.com.
Okay, and it's Pillo with no W, right? So it's Pillo, like pill.
That's right.
All right, very cool. Thank you so much for joining us. I'm Jessica DaMassa with WTF Health.